The election of Donald Trump to the presidency has people on both sides of the abortion debate upset, at least according to the folks we talked with today. The Right to Life side is worried that he won't try to force a national ban on abortion, and the other side is worried he will. It's a national issue with local concerns, and it's our big story tonight. As you might expect, local healthcare providers, especially those who provide abortion services, are most concerned. Along with Governor Tina Kotek, they are bracing for what abortion access could look like under a second Trump presidency. Blair Best has our story.
This is the Magnolia Room. Again, you can see these just look like regular gynecology offices.
Inside the Lilith Clinic in downtown Portland,
we really work to make our patients feel as comfortable and supported and cared for as they can be.
Women come from all over to receive abortion care.
There's a lot of fear and uncertainty, which is, I know, how a lot of people are feeling.
Grayson Dempsey and the rest of the clinic staff, like Shanna Krogh,
doing what we can to see our patients and to continue seeing folks and doing the best we can to take care of them,
are bracing for how a second Trump presidency could impact abortion access. Trump was behind overturning Roe v. Wade in 2022, reversing nearly half a century of constitutional protections for abortion and leaving it up to states to make their own rules, instead of implementing a federal abortion ban, something Trump has said throughout much of his campaign won't change.
Even if Trump is saying, don't worry, I'm not going to attack abortion, I'm not going to sign a ban, he is surrounded by people and advisors who feel strongly about outlawing abortion care. So I have no faith that we haven't seen the worst come, and we are just really trying to brace ourselves.
Same goes for those at Oregon Right to Life, who say Trump's stance on abortion has wavered.
It doesn't look really likely that it's going to be a pro-life administration as the same as it was the first time around.
41 states currently have some form of an abortion ban, leaving women to travel to states like Oregon instead.
Well, I think it's tragedy because, our organization, our mission is to restore the right to life.
Oregon is currently the only state that doesn't have any additional legislative restrictions on abortion care.
Meaning there is no time limit in Oregon on when someone can get an abortion. According to data from the Guttmacher Institute, there were nearly 12,000 clinician-provided abortions in Oregon last year. More than 1,200 were out-of-state patients. That's a nearly 55% increase from 2020.
It's an unsustainable model of healthcare. We now have a country where half of the states, about roughly half of our states can provide care, and in roughly half of our states it's criminalized, which is very confusing and truly unsustainable, I think, for going forward.
This week, Governor Tina Kotek made sure Oregon has enough FDA-approved medication for abortions and miscarriages to last another Trump presidency.
Look, we don't know what's coming. There's a lot of rhetoric. We got to see what's actually being proposed. But we're not waiting.
It's also fear-mongering, honestly. There's been no indication from the Trump administration, from Trump himself, that there's going to be a limit on abortion medication. And so I honestly don't know what she's up to.
Here in Oregon, we know how to stand up for full access to reproductive health care.
Blair joins me now. Blair, let's talk about that increase in the number of out-of-state patients coming to Oregon to get abortions. Where are they coming from?
So, Pat, again, there were about 1,200 out-of-state patients coming to Oregon, more than half, so nearly 700 came from across the Columbia from Washington, which does not have an abortion ban. The next highest was 400 women coming from Idaho, which does have abortion restrictions. And if we look big picture here, across the country, more than 170,000 people traveled out of their home state last year to get an abortion. That's according to the Guttmacher Institute. And due to state abortion bans, many people are traveling more than 200 miles to find care.
Getting an abortion should be just as simple as getting any sort of routine medical care. But if you live in a state where all of a sudden the need for an abortion means that you need to travel, you need to leave your family, you need to find childcare, you can't tell anybody, you're worried about prosecution, you're in a state where you've been told that you could potentially go to jail, you're going to a doctor who says, I can't give you any information about where to go or who to see, you are traveling outside of your insurance network. So you're potentially looking at paying cash. You're coming to a city that may be unfamiliar. You are potentially bringing a support person, but potentially not. You're navigating a new place. I mean, all the things that would come with all of those circumstances really create stress and trauma around what should often be routine medical care.
All right, Blair, so when we're talking about that number, though, of 1,200 people coming to Oregon, it sounds like really it's just the 400 coming from Idaho, and I'm sure it's very disruptive for their lives, but all those other people are traveling down from Washington. So what do the pro-life Oregonians think about this?
So, Pat, they see this as a tragedy, and those at Oregon Right to Life are continuing to work on local pro-life policies at the same time that independent abortion clinics look to up their staffing to meet this demand from out-of-state patients. Pat?
All right. Thank you, Blair. Appreciate it.